ass facts. Pew, 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 pew. Even more mishaps. The Dalkin Shield was an intrauterine device, IUD, marketed as a form of birth control in the 1970s. It became infamous for causing severe health complications, including infections, infertility, and even death, leading to one of the largest product liability cases in United States history. Unlike other IUDs, which use a monofilament string, the Dalkin Shield had a multi-filament string, like a tiny rope with a lot of fibers. This design allowed bacteria to travel up the string into the uterus, leading to severe infections. Many women experienced pelvic inflammatory disease, or PID, a serious infection of the reproductive organs. Some women suffered septic miscarriages after becoming pregnant while using the Dalkin Shield, defeating the purpose of an IUD. The infections caused by the device led to infertility in some women, and in more severe cases resulted in hysterectomies or even death. The manufacturer failed to properly test the device and ignored repeated complaints of complications. The scandal led to tighter regulations on medical device safety and the implementation of the medical device amendments in the United States, which required stricter testing and approval processes. The TGN 1412 clinical trial disaster of 2006 is one of the most notorious cases of a drug trial gone horribly wrong. 6 healthy volunteers in a clinical trial for an experimental drug, TGN 1412, designed to treat autoimmune diseases like rheumatoid arthritis and leukemia, suffered life-threatening side effects, including multi-organ failure within minutes of taking the drug. The drug caused a massive immune response where the body produced too many inflammatory molecules, which can lead to widespread inflammation, tissue damage, and organ failure. The trial was immediately halted, and the 6 men were rushed to the intensive care unit. Some of them were placed in medically induced comas to stabilize their conditions. It became clear that their immune systems were attacking their own bodies. Although all 6 participants survived, many suffered severe and long-lasting health consequences. Some of the men lost fingers or toes due to tissue damage caused by the extreme immune reaction, and others experienced long-term health complications such as immune system dysfunction. The X-ray hair removal craze of the 1920s and 30s. X-rays were marketed as a painless method for removing unwanted body hair, but led to severe burns, radiation poisoning, and cancer in many patients. I mean, I've had burns, and I would rather just pluck my eyebrows. The dangers of X-ray exposure were not fully understood, and beauty clinics were using it recklessly without appropriate medical oversight. Did our fast and loose use of X-rays end there? No, it did not. The X-ray shoe fitter of the 1930s to the 1950s. X-ray machines were once used in shoe stores to measure the fit of shoes, exposing customers to radiation with every use. The long-term dangers of radiation were still not understood at the time, and the use of X-ray machines for trivial purposes went unregulated. The misuse of X-ray technology in this way helped prompt the development of tighter controls on radiation exposure, especially in non-medical settings, and led to greater awareness of the risks associated with radiation. The insulin overdose disaster of 1921. Shortly after the discovery of insulin, an early batch given to diabetic patients led to severe hypoglycemia because of dosing guidelines not being fully developed. After successfully testing insulin on diabetic dogs, the researchers proceeded to human trials. However, the early purification methods for insulin were not perfect, and the exact dosage required for humans was unknown. The insulin they had developed was not always consistent, leading to severe problems when injected. This incident spurred careful study into the pharmacokinetics of insulin, leading to the development of safe dosage protocols, and have since saved millions of lives.